Minimally invasive surgical techniques continue to transform how we are able to help men with an enlarged prostate. Today, I'm excited to chat with urologist Dr. Dean Elterman about how water power can be used to help men with their symptoms due to an enlarged prostate. So listen in. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. It is my pleasure to welcome Dr. Dean Elterman to the Prostate Health Podcast. Dr. Elterman completed residency training in urologic surgery at the University of Toronto. He then completed a fellowship in Voiding Dysfunction, Neuro-Urology, Female Urology, and Pelvic Reconstruction at the Memorial Sloan-Kettering Cancer Center, New York Presbyterian Hospital, and Weill Cornell Medical College in New York City. He has worked in the area of men's health and survivorship at the Cantor Men's Health Center at New York Presbyterian Hospital, Weill Cornell Medical College, and at the University of Toronto. He is the medical director of the Prostate Cancer Rehabilitation Clinic at Princess Margaret Hospital Cancer Center. Dr. Elterman is a true innovator in men's health and continues to embrace the integration of minimally invasive surgical therapies in the management of an enlarged prostate. Dr. Elterman, welcome to the Prostate Health Podcast.
It's great to join you tonight. How are you doing?
Doing great. Appreciate you coming on. So Dr. Elterman, as a urologist, the last 5 years have been really exciting with new advances in technology, which are really allowing us to better care for our patients who suffer from symptoms of an enlarged prostate. Can you share with our listeners how common is BPH or enlargement of the prostate?
Yeah, so enlarged prostate really affects the majority of men as they get older. And the statistic that we usually hang our hat on is 50% of 50-year-old men and up to 80% of 80-year-old men. So pretty much if you live long enough, you're going to have BPH. And often we say that it's not if, but when you'll develop an enlarged prostate. So it's really, really common. And when you do develop an enlarged prostate, there are varying degrees of how it may impact your quality of life. So for some men, they really won't feel much, maybe some reduction in their urinary flow. But for other men, it can be really bothersome in terms of a weak stream. The stream stops and starts. They don't feel like they empty their bladder all their way. They wake up at night having to urinate. So our interventions and our treatments are really tailored around the degree of bother when it comes to an enlarged prostate.
Now, again, you are seeing these men on a daily basis in your practice, and you kind of alluded to this already, but how are you seeing this really affect their quality of life?
Yeah, so this can really impact men's quality of life because they're always thinking about where's the next bathroom. They're having to plan their lives around perhaps when they're going to go to the bathroom. A lot of men are chronically fatigued, again, because they're waking up at night from something we call nocturia or nighttime awakening. And it's that slow stream, that feeling of not emptying. And of course, it could be much worse. You could go into urinary retention where you're not able to urinate at all. And you can develop things like urinary tract infections or bladder infections. Stones can form in the bladder. And you can even develop bladder problems as well, like an overactive bladder due to chronic obstruction from the prostate. So it can really impact men quite significantly.
And it seems like, you'd mentioned it affecting the bladder could, certainly, and we know that it affects the bladder health as well, long term.
Yeah, absolutely. So what ends up happening is you can get permanent changes to the bladder muscle itself as a result of having the bladder squeeze extra hard to get the urine out through a blocked prostate. And so not only are you having symptoms of an enlarged prostate, but you can develop independently bladder dysfunction, bladder problems that are really permanent in many men. And so you're going to have to come up with a whole new set of treatments, not just for the prostate, but for the bladder as well.
Yeah, that's significant. So in your practice, what are some of the various minimally invasive therapies that you're currently utilizing?
Yeah, so we have really advanced a lot from the old-fashioned TURP or transurethral resection of the prostate, TURP. TURP has really been the gold standard for almost 100 years now, and it hasn't changed all that much. But over the last, I'd say, 5 years or so, there's been an explosion of new technologies, typically more minimally invasive, easier on the patient, a faster recovery. So things that I'm using in my practice are green light photovaporization or green light laser of the prostate. And then really when we get into the minimally invasive treatments, we have something called the prostatic urethral lift or the urolift. We have something called convective water vapor or REZUM, R-E-Z-U-M. That's a water steam treatment. And we have a few new stents. One is called the iTind, I-T-I-N-D, which is a temporary implantable nitinol device. And the last one, which is very exciting, is something called aquablation, which is a high-velocity water jet to treat the prostate.
Well, thank you for sharing some of those really innovative technologies that we're starting to have available at our fingertips. For our listeners, I was going to see if we could really just focus in today on one of the technologies that you did mention, the aquablation. And, so how does this technology work?
Yeah, so aquablation is an entirely new way of treating the prostate. It is fundamentally different from everything else that we have done and are currently doing. And aquablation is unique in a few characteristics. So number one, it uses a high pressure, high velocity water jet. So imagine power washing the side of your house or your car. It's a high velocity jet. There's no heat. So a lot of these other treatments use heat, whether it's electricity or a laser, but it's a heat-free water jet. The other is that it uses real-time ultrasound imaging. So instead of only using your eyes, we actually have an ultrasound during the operation, taking live pictures of the prostate to help guide how the surgery is going to be planned and executed. And thirdly, what's really amazing is that it's robotically executed. In other words, what the surgeon does is they plan out the treatment on a screen using the ultrasound images, but the actual movement of the water jet is performed by a robot. In other words, I just plan it out and I put my foot on a pedal, and the robotic automatic system of the machine actually does the sweeping of the jet back and forth in a very, very fast way. So we're actually able to get high precision removal of the prostate tissue using robotics and real-time imaging. And the entire operation that would typically take an hour or an hour and a half even is reduced down to 5 to 10 minutes.
So you had mentioned that this technology uses water. So again, how does it differ from some of the other technologies in managing their BPH?
Well, I think aquablation is unique in that it really utilizes that heat-free, robotically executed, real-time imaging to remove a huge amount of tissue in a very short period of time. And unlike some other procedures where there is a size limitation or a shape limitation, so for example, TURP, urolift, REZUM, we usually use those in prostates that are between 30 to 80 cc's in volume. But aquablation, being size independent, allows you to do a prostate volume of any size. So you can go from 30 all the way to 300, a golf ball all the way up to a grapefruit. And it doesn't require any special training aside from, doing those first few cases and getting used to it. And so regardless of your level of experience, we've been able to show in research that the outcomes are the same, reproducible time after time. And so you're able to get a really good outcome every single time because it's the robot that's carrying out the surgeon's plan.
So how long has this technology been around for?
So it was designed by a few scientists, bioengineers out of MIT. They're in the Silicon Valley outside of San Francisco, and it's been through a number of iterations. But really, the research studies have taken place over the last 2 to 3 years, and it had FDA approval around late 2018, 2019, if I remember correctly. So it's really been commercially available for under 2 years now.
We're going to take a quick break here, but we'll be right back to learn more about this interesting technology with Dr. Elterman. Thanks again for joining us today on the Prostate Health Podcast. If you're enjoying the show today, make sure you visit my podcast website at www.prostatehealthpodcast.com. There you can find show notes to all our episodes. You can also click on our resources tab, where you can find links to our trusted partners of the podcast, as well as links to books, resources, and products, all of which can help in your journey with either an enlarged prostate or prostate cancer. You can also sign up to receive my free What to Expect guide, which includes checklists of what you need to bring and how to prepare, including what to expect with 3 different scenarios, including your initial urology clinic appointment, a prostate biopsy, or prostate cancer consultation. Sign up for the free guide on the homepage of www.prostatehealthpodcast.com or access this guide directly at www.prostatehealthpodcast.com/clinic. So who would you say, you'd mentioned being able to treat prostate glands up to 300 grams in size, who would you say is an appropriate candidate for aquablation?
Well, I actually think it's almost any man. I mean, unlike some of these other treatments, you're able to do any size, you're able to do any shape. So prostates come with different lobes. Sometimes there's something called a median lobe, which is like a middle lobe that can cause an obstruction. Some treatments don't work very well with a median lobe, but aquablation does. For men who want to have a significant improvement in their flow, as good as, say, a TURP operation or another major operation, you'll get those results with an aquablation. Additionally, it's very good at preserving sexual function. So one of the side effects of removing a large amount of prostate tissue could be either erectile dysfunction or more commonly ejaculatory dysfunction, which means dry ejaculation. And with the aquablation, it's actually very low. In fact, there's no new erectile dysfunction, and the rate of changes to ejaculation is around 10%. To put that in perspective, a TURP operation, the dry ejaculation rates are between 50 to 80%. Same is true for enucleation, like a HOLEP, 50 to 80%, and even laser ablation, green light laser, is probably around 40%. So you're able to have a biggish type of operation, but still reap all the benefits in terms of sexual function that you would see with minimally invasive treatments like Resume or Urolift.
Wow. I mean, it seems like a great technology. Now, how long does this, you mentioned it's a fairly rapid procedure. I suppose it depends somewhat on the gland size, but typically how long does the procedure, take to perform?
Yeah, well, this is really what distinguishes it, because a lot of the time is spent setting up the system, putting in the ultrasound, measuring the prostate, and then planning on almost a touch screen where you want the jet to go. The actual surgical time, so when the water jet starts to finishes, is actually usually between 3 minutes up to maybe 8 minutes for massively enlarged prostates.
Wow.
So these types of prostates, if they were done by enucleation or laser, would take well over an hour, maybe even 2 hours. And we're able to remove the same amount of prostate tissue in the matter of minutes, single-digit minutes. So time in the operating room is significantly reduced with aquablation, for sure.
Well, certainly that seems like one of the advantages. What are some of the other advantages that you counsel patients on regarding this technology?
Well, again, we're able to have a reproducible outcome every single time, meaning it almost takes the surgeon factor out of it. You could have someone who's done 1,000 TURP operations and 5 TURP operations, and they'll be very different. But you can take, in the clinical trials, we had centers that had no experience doing aquablation, and in fact, their outcomes were the same as other centers who did have experience, and in fact, they had the same outcomes of the TURP groups who had surgeons doing those surgeries for decades. In other words, it almost takes the skill away from the surgeon, and you're able to have an amazing outcome, in my opinion, regardless of the experience. I mean, obviously, surgeon experience is always going to matter in terms of the planning, but it's the robot that really takes it out of the literal hands of the surgeon and gives you an amazing, precise, reproducible outcome each time. I think that's quite interesting.
Yeah, that's very interesting. Now, from a patient experience standpoint, let's say, what can a man expect with the procedure as far as, let's say, first of all, pain in terms of in recovery?
Yeah, so, this is a very similar operation to other types of ablative procedures. We're not using heat, so there's not any sort of burning taking place. We typically wouldn't require any sort of narcotics. Like most prostate surgeries, it does require a catheter afterwards to help irrigate away some debris, some urine, some blood clots. But generally, men feel very comfortable. We're able to do this either as a day procedure where they go home the same day, especially if it's done early in the morning on a smaller size prostate, or maybe a short stay overnight. But remember, the alternative for many men, including those with very, very large prostates, would be something called an open simple prostatectomy, which is actually a surgery where they make a cut through the tummy, down through the prostate, open the prostate, scoop out the part that's blocking it, sew it up, and they're in the hospital for quite a while, in fact. So we're still able to do something through the urethra without any cutting and get men home in less than 24 hours typically.
Yeah, that's really impressive. Now, how long do you typically like to leave a catheter in place before you get them voiding again?
We usually take the catheter out at the time of discharge. So much like a lot of other prostate surgeries, the catheter will be in, again, under around 24 hours or so, maybe even less, and we get them to start voiding right after.
That's great. And as far as counseling patients, how quickly should they start to see some of their improvement in certain symptoms that they're having going into this?
Yeah, the one thing that's most notable that men say is the force of their stream improves dramatically almost immediately because you've really created a large cavity inside the prostate by removing that tissue. So by taking away that obstructing part of the prostate, the flow will be dramatically stronger right off the bat. Still, though, there's going to be some irritation in the prostate, you can imagine, since we've swept through it very quickly with this water jet. And that's going to have to heal. The inside of the prostate, the lining is like the inside of your cheek. So if you've ever bitten the inside of your cheek, it's rough and raw, but eventually becomes smooth again. So the same thing over the subsequent few weeks are going to happen, where it's going to smooth out and some of that irritation, burning when you pee, frequent urination will settle down.
Now, lastly, what are some of the potential risks of the procedure?
Well, with all procedures, there are some small risks. Generally, urinary incontinence is, if it does happen, it's transient or temporary. Again, single-digit risk. Risk of bleeding has gone down dramatically. We've really refined the technique, and the risk of bleeding now is in the realm of 0.5%, very low, with newer techniques in terms of what we call hemostasis or stopping bleeding. Irritative symptoms like frequent urination or rushing to the bathroom, I really wouldn't call those are expected. And then, of course, it's the changes to ejaculation, which are around 10%.
Well, definitely very interesting technology, and we really appreciate you kind of going through that with us. I think that's going to be very helpful for our viewers. And we're kind of nearing the end here on our podcast episode, and I really know men would be interested to hear from you in regards to some of the other minimally invasive techniques you're able to offer your patients, especially how you counsel them regarding each option, and as well as, factors that come into play when figuring out maybe which option is going to be best suited for various men. The great news is we will be sticking around just briefly to be recording some bonus video content with Dr. Elterman for the upcoming launch of the Prostate Health Academy. And for those that are interested, including some other bonus recordings from other podcast guests, make sure you go ahead and sign up to our wait list to make sure you have the chance to access this when we launch it. Just go to www.prostatehealthacademy.com. Again, that's prostatehealthacademy.com. Scroll down and sign up. Well, Dr. Elterman, any final thoughts for our listeners today?
I think that there have been really significant advances in the treatment of prostate enlargement, benign prostate enlargement. And, while the TURP has been around for almost 100 years, I think men deserve the opportunity to have newer technologies, and never before have we had so many options. I think that if you have the surgeon in your community who has aquablation, you should talk to them because, again, I think it allows you to have a really dramatic improvement in your urinary flow, remove a lot of tissue in a very precise, fast way with results that are very close, the same as typical TURP and other types of more invasive surgeries, but in a less invasive fashion. And then, of course, we have this category of minimally invasive therapies, whether it's the UroLift or the Resume, and a couple of new stents like the iTind available. Those are really for men who want to sort of balance the risk-benefit profile, who want something quick and easy while maintaining sexual function, but maybe being able to get off medications. And so they're all have their pros and cons in terms of keeping sexual function, how quick they are, their speed of recovery.
Well, we really appreciate you taking time out of your busy schedule to chat with us today on the Prostate Health Podcast. You've really delivered significant value to our listeners today. Thank you again.
Well, it's been a pleasure to join you from Toronto, and I hope you enjoy the podcast. Thanks again.
Thank you. Thank you again for listening to the Prostate Health Podcast. follow me on Twitter and Instagram at gpullmanmd. Don't forget to join us next week for another episode.